Hey guys, this is Ulysses again with Amici Hospice. Quick lesson today on wound care and wound care orders. So on occasion, your patient will have severe wounds and you will need further assistance from a wound care company. We are contracted with a few wound care companies who do amazing work. So if it comes to that point, guys, let's make sure we ask for a wound care consult. One of the best ways to go about it is to go ahead and take pictures. Remember, we want to be very descriptive when assessing the wound. We want to know, the width, the length, the depth of all of these wounds, if there's any necrotic tissue, the whole works. You just want to make sure that you're very descriptive and detailed for the doctor so that the doctor or Ms. Seaham can go ahead and provide the consult order for wound cares. Once there is a nurse that goes out or a doctor that goes out and assesses the wound from the wound care company, the wound care company will provide wound care orders. They'll provide their own medication, they will provide their own supplies, and they will provide their own wound orders. This is something that the RN needs to be on top of to make sure that we get the wound care orders and the wound care orders are actually dispersed out to the rest of the care team, the LVN and the CNA, as well as the nurse practitioner. I'm asking the RNs to go ahead and follow up, make sure that all the supplies that the wound care company ordered are at bedside, and that the wound care orders are followed as directed. The wound care company might tell you to be there, change the wound 2 or 3 times a week. As an RN, we know that the wound care needs extra visits because we need to make sure that dressing gets changed every 2 days. If the patient is seen once a week, then this is a lack of nursing and a lack of frequencies that's not going to allow for the wound to heal. So I think as nurses, we might want to go ahead and recommend frequency increase so that we can go ahead and keep an eye on the wound, make sure the wound care orders are carried out appropriately so the wound can get better, as well as take pictures to make sure that we can document and proof the status of the wound, if it's getting better, if it's getting worse. This would be a good reason to go ahead and increase the visits due to wound care orders, guys. Sometimes wounds need to be changed more frequently because they get soiled, they get dirty. This is where you need to make sure that you reach out, like I said, to your LVN and your HA to make sure that they're aware of these orders and they know how to do it. If you need to walk them through it, then it's probably a good idea. HAs don't really do wound care orders, so this would be something that the RN and the LVN do, but we need to work as a team to make sure everybody's on the same page and we provide the correct wound care. Also, with these pictures and your assessment every time you go, we report it to the wound care doctor, we report it on Slack, and this will help us stay, updated and have the most recent information for the wound. With that being said, guys, I think this concludes our lesson on wound care. And if you have any questions or concerns, feel free to reach out to the office and, we can help you out. Thank you very much for your time, guys.